Everything looks good on my end, but we'll get started.
Okay.
So today we're just going to be talking about exercise and migraine in today's part one, and we're going to be talking about exercise's impact on migraine. So my name is Dr. Sam Kalakidis. I'm a physical therapist based in Philadelphia. And then my guest here is Dr. Lauren Nabany, who's a board certified neurologist and a fellowship trained headache specialist. She's the founder and medical director of Integrative Headache Medicine of New York and serves as an assistant clinical professor of neurology in Mount Sinai's Icahn School of Medicine. And thank you for joining me today.
Thank you so much for having me. This is one of my favorite topics, so it's a pleasure.
Oh, yes, mine too. But I'd love to start getting into some of the questions I have and like discussion points that we wanted to cover today. But we'll just jump right in. So I want to know if what are some significant physiological changes that kind of occur in somebody when they have migraine and when they start engaging regularly in exercise?
Great question. So just to simplify, migraine brain is hyperexcitable, right? So I feel like it is giving off pain signals inappropriately. So when anyone starts an exercise program, it is a change to the system, and migraine does not like any change. So I find that people are like, okay, I'm going to go start an exercise program. I'm going to jump all into it. And that just makes migraine so much worse. We think that it has to be gradually eased into and also doing the right exercises. And we'll talk about that later.
Yep.
And the guidance of how to activate muscles, how to get your heart rate to the right intensity is really important. But what really happens with migraine is the brain is just going through these changes, like you said, that it's unhappy, it's inappropriately activating pain signals, and exercise can feed into that acutely, but in the long term can also help reduce that.
Yeah. So what are some of the changes that kind of occur as people start engaging more often, and how does that actually end up decreasing migraine severity or frequency?
So exercise produces endorphins. Endorphins are our natural pain relievers. And over time, the more you produce endorphins, the more the brain sort of calms down and starts to relax in response to exercise. So in the moment, while one of the migraine criteria is that migraine is worsened by exercise, acutely in that moment, sure, but over time, it actually tends to decrease the frequency and severity of migraine overall. So it really is looking at endorphins. There's other changes that go on, but that's really the most important one.
Yeah, and that's a lot of what I talk about with my patients, that like acutely, yes, exercise itself is an added trigger. So during that time, there's a release of neurotrophic factors as well that, increase neuroplasticity, but that also increases your brain's sensitivity to light, sound, and other stimuli. So there's always that potential after exercise or during exercise that you can have a potential attack, and it's learning how to control your other triggers and being mindful of that increased sensitivity immediately after exercise.
I also will say I have found that if you intervene with exercise early during an attack when symptoms are still mild before their central sensitization, before it has progressed, I found it to be beneficial, as long as you're not like going and running a marathon, like it's to be
Yeah.
beneficial to do some exercise to produce those endorphins as a natural remedy to prevent it
Mhm.
from progressing. It's
And
just finding the right timing.
yeah, and you're talking about like a slow walk or like a mindful yoga or something like that.
Exactly.
Yeah.
Hmm.
And
Yeah.
that I typically recommend that as well. I've had one patient over the years that said they could abort an attack by going on a 45-minute run, and I was like, that sounds terrible.
No, I've had a lot of patients who say walk outside in fresh
Hmm.
air, getting a
Yep.
little bit of heart rate activation, but not too much. And then also things like yoga, gentle movement can be helpful.
Yeah. Right. Um, so many of our patients that I'm sure you have and I've had have concerns about exercising triggering migraine, and we kind of just talked about it. Could you actually just talk a little bit about the differentiation between like migraine being triggered by physical activity and then primary exertional headache?
Absolutely. So I feel like they can sound similar, but it is different. So, like we said before, one of the diagnostic features of migraine is worsened by physical activity. So, everyone with migraine is going to somehow have some worsening with intense physical activity, but a primary exertional headache is one that comes on suddenly, reaches maximal intensity during, like acutely, it goes from 0 to 100 quickly, and it only happens during exercise and with usually with higher heart rate activities. There is an overlap with migraine, but people usually are like, wow, I had this acute onset of a severe, worse headache during exercise and solely during the exercise, and it's not happening at other times.
Gotcha. Thank you for explaining that. Um, with your experience and how you work with your practice, what are some like the more promise? What's your like clinical experience with helping patients manage their migraine symptoms with exercise and preventing those like potential attacks?
So it's always great to have someone like you for my patients to work with, but I think it needs a lot of guidance. I feel like I usually recommend slow, gradual introduction. If I had all the time to set out an exercise program, it would probably look something like the modified Levine protocol for POTS, where it starts out with gradual, like short duration exercises
Hmm.
that are more low impact. And then as time goes on over weeks, gradually adding time and intensity to those exercises. I usually say starting with a mix of cardio, and you always want to do some resistance training,
Hmm.
but trying to balance it out and then increasing those over time, not super like not running, not doing a lot of pounding, not doing a lot of high impact activity at first, but it really is slow introduction. So I tell people if you don't exercise, let's aim for 2 days a week of 10 minutes of getting your heart rate up. Let's just start with that. And
Yeah,
then go from there. And then I do like playing around with heart rate targets, which we could talk about, but I think that's
yeah,
more down the line for patients.
yeah. So that's normally how I start with patients when we're trying to get into like a long-term exercise protocol or a program for them is really figuring out where their baseline is, like what was the maximal amount of exercise we can prescribe without triggering
Mhm.
attacks. And sometimes that takes several sessions unless they have already been trying to like exercise or already are exercising, but they just haven't been able to progress because they're having too many attacks. And then I'm using some type of measurable way for them to like gauge intensity. So is it heart rate? So do they need to wear a heart rate monitor? Are they just going to use like rate of perceived exertion? So like on a scale of 0 to 10, how hard are you working? And getting some parameters that way, so they have a way to determine how hard they're working early on and at what level can they work that doesn't trigger attacks for them.
Exactly. I call it sub-threshold training. That's like basically
Yep.
right up to that point where it will trigger and you stop there. And that's where I want to start as well. And then
Yeah.
slowly push it.
And I often like for some people, it's okay that they occasionally trigger an attack during exercise because we're trying to progress them and figure out what their thresholds are. And I'm okay with people occasionally having a trigger, but I think some people they push through exercise and they're always triggered at each time, but they keep exercising. And I feel like that's a way for them to really sensitize themselves to that intensity of exercise. So if you are exercising and you're triggered all the time when you try to go for a walk or a run, that really you shouldn't be getting triggered every time. Occasionally, that's normal. Every time is not, and you're possibly sensitizing your nervous system to always become triggered with that level of intensity of activity. And
Absolutely.
now there are some myths around like exercise and migraine, and the one I wanted to bring up is that for some believe that like high intensity exercises are totally off limits for somebody with migraine. Is that true?
Absolutely not. There's actually a trial done looking at high intensity interval training for migraine, and actually doing those short, I think it was 20 minutes of hit, was beneficial long term for migraine. So doing, again, short term, doing right now, if you're not used to high intensity exercise, it is going to worsen it, but long term training and doing it consistently actually helps.
That's good to know. Yeah. And I see that too in a lot when I'm working with patients is that we can't really immediately jump into high intensity activities, but it's a great way to like we start with low intensity, progress to moderate, and then start doing some intervals where you're getting
Mhm.
exposure to those levels of increases in heart rate and blood pressure and intensity so that they can begin to tolerate them better.
Exactly.
It's really great. Um, so how important do you think it is for people to have, like, are they able to just start exercising with like a generalized plan, or do they really need to have more of like an individualized program because of migraine?
I would love to say that I feel like even if I counsel let's exercise, it's overwhelming, right? Like
Hmm.
where do I start? What do I do if people don't have a gym membership? What's the amount of time? Like what exercise, especially with strength training parts of it also. So I find that just saying exercise, I don't really see much compliance there. If someone is already exercising, if they're already have a routine and then migraine has dampened that a bit, I feel like they're more able to modulate what they're doing and push. But I feel
Hmm.
like everyone needs guidance. That's why people come to me for guidance on what to do for migraine. And I
Hmm.
feel like a prescription for exercise and actually telling patients exactly what you want them to do
Hmm.
is important for compliance.
Yeah, I agree. So, and it's definitely something where if people want to start trying on their own, always start easy and then working harder. But if you start having problems, you're not able to progress, you're not able to find an intensity level where exercise is suitable for you, that's really where it's key for you to have some professional guiding you and giving you advice and prescribing the exercise, so you can, one, take that burden off of you of planning something that you're not really an expert in, and then have that plan laid out, and you just have to follow it and then report back with any problems that might occur during those plans.
I think it's also really important. A lot of patients with migraine have neck pain. And I see this all the time, is that the neck pain part, like let's say they're doing a bike and they're hunched over, or they're doing certain overhead exercises.
Mm-hmm.
That can also trigger because of the neck positioning. And I find that a lot of people don't work on the small muscles, on building the small muscles to support the neck. It's all these big movements. And therefore, I think it's important to talk about, I'm sure you do this a lot, on which muscle groups need to be strengthened, which ones are activated during certain exercises, because just doing a general overhead press is maybe good for one person, but if you're weak in other areas, it's going to activate other muscles.
Yeah. And so that's just something that comes up a lot for my practice. One thing, and definitely for people that are runners, getting neck strengthening in, because when you're running, your head's bobbing up and down, and your suboccipitals are doing a lot of stabilizing then. And for a lot of people, when that muscle group becomes fatigued, it can start sensitizing your trigeminal cervical nucleus, because that's also going into the same area where migraine pathophysiology is stemming from for some people. And then you start getting that hypersensitivity in that area, and then an attack can occur. So working on, one, strengthening those muscles, but also strengthening the deep cervical flexors, so they can also aid in that stability for at least running, as the example there. And strengthening that can also help with like shrugs, and shrugs attach just above the suboccipitals at the base of the skull. But when you start sensitizing those areas, or if it's too tight and you're irritating it further, you can potentially cause more migraine attacks because of the sensitivity that's occurring there. But we can decrease that sensitivity by gradually exposing you to that stimuli at a sub-threshold.
And I know we're going to probably talk about this at later times, but the importance of the balance between stretching and strengthening, I definitely think at some point we will touch on that, about how when things feel tight, it's not always about stretching.
Yeah, and I can cover that now. Most of the time, when you feel tightness in the back of your neck, or really any muscle group, it's rarely that muscle is tight and shortened. It's more likely that it's fatigued or it's in pain. So it's trying to limit you from using it, so it has that tightness feeling. So when you're constantly exposing it to more and more stretching, you're fatiguing it. When you're stretching, your muscle fibers are still working and contracting against that stretch, and they will fatigue out further. And then for the suboccipital muscles, those muscles don't want to be stretched at all, because their primary job is to control the head on the neck. And if it feels unstable or it's at end range, it's going to fight back because it doesn't feel safe at end ranges. The neck doesn't want to be at an end range position.
Absolutely. Yeah. Thank you.
Yeah. Very good. So the next question I have is, what advice do you have for patients who are hesitant about starting exercise for fear of exacerbating their symptoms, or for people that maybe try to exercise and every time they do, they tend to get worse with their condition?
I think it's sitting down and saying, hey, for the ones who are, what exercise are they doing that's making it worse? And then, like you said, starting somewhere before that happens. There are many different types of exercise also. So I think that just saying that there's only one type of exercise that helps. Like some patients might like swimming, some yoga, some want to run, some want to walk, some want to cycle. There's all different types of exercise. And I think finding the one that works for you is important. And therefore working with a professional who can go through all the different options and talk about how it relates to migraine and come up with a plan. That's the most important thing. I think it's having a plan.
Yeah, I agree with that. And for a lot of the studies look at, the primary ones are like walking or running, cycling, and yoga. A little bit of strength training is starting to get more in there. But for the most part, a lot of people want to do other types of workouts or integrate multiple types. And the reason those are studied is because they're easily measurable.
Yeah.
But this is where kind of the art of exercise prescription comes into play for people, is learning to take into account not just, oh, here's the amount of exercise you need to improve your condition. It's how do we layer that in with your work life, your family life, the other responsibilities you have, and your other triggers. And that's where sitting down, talking about that, and figuring out how do we put exercise into your life to where it becomes not just something you do for a short term, but a consistent lifetime habit, because that's really what's necessary for somebody with a neurological condition, especially migraine, is that exercise becomes part of your everyday lifestyle.
Absolutely. I look at it as like a medication. Like you need to take it consistently in order for it to work.
Mm-hmm.
And I think a lot of times with our busy lifestyle, even me, I'm like, I'm going to go run and I'm going to go do all these things. Like maybe I'll do it once, but it's
Mm-hmm.
not sustainable. And it has to be something that can fit into your life in the amount of time. And also to make sure you're prepared for it. Like just going and being at work and then jumping up and starting to run is not going to prep the brain
Mm-hmm.
well. So it's also looking about how we can cushion the exercise, making sure we're well hydrated, making sure that we're eating well, that it works at the time that you're doing it
Mm-hmm.
can play a big role. And I'm sure you talk about that with your patients too.
I definitely. One example I had yesterday was the patient frequently believes that like when storms come in and there's pressure changes with storms that they often get triggered with that. And it was like, well, do you try to exercise? No, I just don't do it. I'm like, well, why don't you just try switching the day you're exercising and moving around? So like what we're doing now is look ahead at the week ahead for the weather report and changing it based on the days that they think might be having a problem for them.
Planning.
So
It's
that way it's like,
all about planning,
plan
but
it. I
planning
know.
is really hard. So having
Yeah.
someone to guide them in planning is important.
Yes, exactly. And there's something I do want to say when, there is a clinical practice guideline for exercise for migraine, but when you actually look at each individual study, not all of them are actually reaching what's called the ACSM guidelines or American College of Sports Medicine guidelines for exercise. So that would be 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise for the average adult. But most of those aerobic and strength training studies don't actually always meet those recommendations. So you can actually work out not at a recommended level to like get the physiological improvements that often encouraged, but even some exercise can help you improve your migraine condition.
Yeah, good point. So I
Yeah.
have you here talking about it.
Yeah. Dr. Nevin, is there anything else you want to talk about today? I think those were all the questions I had and wanted to talk about for this for part one today.
Um, I think I just want to encourage everyone not to be afraid of exercise because I feel like exercise becomes this huge, just like weight on people's shoulders. Like, okay, I have to exercise. I'm going to start tomorrow. I'm going to start tomorrow. I'm going to start next week.
Mm-hmm.
But it doesn't have to be. I think taking it in little pieces and working with someone like you or
Yeah.
someone who is an expert in migraine and exercise will really help to guide and not to be afraid of exercise, but to really jump into it because it is a really useful tool, not only for migraine, but overall health and well-being.
Yeah, and that can help decrease other comorbidities that are often associated with migraine, like fibromyalgia, which benefits greatly from regular strength training.
Insomnia, which is a
Oh,
huge
yeah,
one.
and that's one of the physiological benefits of exercise is that it actually helps you with sleep. It helps you regulate sleep. It puts you on a better day-light cycle, so it helps with your circadian rhythm. And if you do it later in the afternoon, but not too close to bedtime, it can help you actually fall asleep based on like the hormones and neurotrophic factors that are released that help you fall asleep faster. And exercise, a lot of people use it to like stress management. Like I'm stressed, I'm going to work out, and they feel better. But it also helps with patients or just everybody's stress, their neuroendocrine stress reactions. So like when you're experiencing periods of stress, your hormones come up, your stress hormones come up, and then they would come down afterwards. Well, exercise is a great way to dose response that. And what I mean by that is when you exercise, our stress hormones are released because physical activity is itself a stress. Well, now it makes our body better and more resilient at tolerating those levels of moderate stress. But then it also helps your body learn how to recover faster from periods of acute stress. So that way you're in that sympathetic state.
Good point.
Yeah.
Do we
All right,
want to
great.
give our viewers any ideas of what we're going to be talking about in the future?
Yeah, so episode 2, let me pull up the details here. We'll be talking about tailoring exercise for your specific migraine presentation. So we'll kind of talk about how to adapt exercise routines for different phases of your attack, and offer advice on kind of like the types of exercise that are suitable during different phases and whether you're acute or chronic, and talking about like aerobic versus strength training, and kind of exploring some of that. So if you guys have any questions, feel free to comment on this post later so we can address some of those in our next talk next week.
Yes. And also, hopefully, you'll take me through some exercises so we can also show everybody
Yeah,
some of the things that you do.
great. Well, yeah, I would love that. Great. Well, Dr. Nandini, thank you for joining me today, and we'll be back I believe next Friday as well. Let me double check.
Maybe, I think
I'll get it.
2 weeks.
2 weeks. Yes, 2 weeks. 2 weeks from 2 weeks to next Friday. Yep. I'll post it on the schedule though so people can see it, and I'll make sure I have reminders out there so people can join later.
Okay. Well, it's a pleasure.
Yes, actually,
Like you said, if anyone has questions they want us to address in the future, please let us
so
know.
there is one question here, and I'll read it out for you so you can answer. Are there any medications that can help offset migraine before or during an exercise?
Yeah, so there's a lot of strategies that I employ. I feel like, all right, I'm going to preface it by saying, are they evidence-based? Some are my own personal regimen, but dosing anti-inflammatories, again, depending where you are in your migraine journey, I wouldn't say using a lot of anti-inflammatories is ever a great idea, but we do know that using anti-inflammatories like indomethacin, one that's specific, or even things like ibuprofen or naproxen, but about 30 minutes before exercise can help. Um, Personal favorite of mine that I feel like is, again, my personal anecdote is magnesium. So we know that levels of magnesium are lower in patients who have migraine. And if we try to stabilize those levels beforehand, maybe it helps to offset the imbalances that will bring on an acute attack. So I have people dose with extra magnesium about 30 minutes before exercise. And then one of my favorites, because we talked about how heart rate is very important, is
Mhm.
using timolol. So timolol is a beta blocker. It lowers heart rate, but using the eye drop version of it. So there's like one small study of using timolol eye drops for rescue of acute migraine attacks. But the way I like to use it is doing it before exercise. It's not that much of it's absorbed. It's a small absorption, but it does tend to modulate a little bit of that heart rate rise. And I find that it's very easy, simple. There's really no risk of overusing it. And I found that that can help certain patients. Again, it depends on what the triggers are, which exercises that trigger. If it's a heart rate elevation, then I tend to
Mhm.
find that to be helpful. But there's plenty of others too, but those are my
Okay,
main ones.
that's interesting. There's just I've heard of the migraine or the magnesium dosing to help with exercise-related migraine attacks, but I hadn't heard of using an NSAID or an anti-inflammatory like that. That's interesting and good to know. How can patients ask their doctors about that if they're interested in kind of like working on those treatments?
I think bringing up the fact that exercise is important in your life, a lot of times I think appointments get rushed, right? And there's not that much time to focus on it, but saying, I want to exercise, I am getting triggered with exercise. Do you have recommendations for things that I could do medication wise specifically to pre-treat? It's different from overall prevention. Pre-treatment happens before you're going to do the exercise, and then rescue happens if it happens after the exercise. So you could also bring information that you hear to your doctor and discuss it. But I think talking about pre-treatment for exercise is a really good topic of conversation. And actually, I have a lot more on that we can talk about in the future.
Great. Yeah, I'll definitely put in some questions so we can talk about that. That might even go into next week where we're tailoring exercise. So how can people prepare for exercise, go
Yep,
through exercise, and then recover after
it's a
exercise?
great idea.
All right. Well, Dr. Naimani, thank you for joining with me today. I hope everyone learned a little bit and will join us again in 2 weeks for the next part of the series.
Well, thank you. Have a wonderful rest of the day, everyone.
Bye-bye.